In the last 2 decades, outbreaks of infectious diseases of epidemic potential have become increasingly frequent and severe. Within iSense, we have the ability to develop and test the tools that are both good for the UK as well as for developing country field settings.
The main aim of iSense is to build a new generation of digital sensing systems to detect infectious diseases much earlier than we currently can. Our aim is to build new tools to help support public health efforts in the UK and internationally.
We've been looking at what people are tweeting or querying. And when people are sick, they may query for symptoms such as cough, cold or fever. And if we count the number of people that are making those kinds of queries or tweets, then we can make an estimate of what proportion of the population has flu at the current time.
The iSense researchers have been developing tests against a range of pathogens which will range from Ebola, HIV, influenza to bacterial infections.
We hope that these tests will be easy to use, very reliable and able to be used within the field and really make a difference in the way that people can be diagnosed and then of course treated.
I think the key advantage is that our system is based on a lateral flow test, which is like a pregnancy test, and it's connected to a smartphone, so essentially it can be done next to the patient.
The ability of mobile phones to help map outbreaks is also really important, using geospatial information to identify disease hotspots and help support interventions.
What our dashboards have been enabled us to see is where the gaps have been in trying to get those people who are HIV infected to receive treatment. One of the characteristics of dashboards is that this is real-time representation of information. So it means as our research is continuing, we can continually refine and adapt our studies in order to ask the right questions.
The work of iSense is really important in enabling countries to be able to achieve the Sustainable Development Goals. Sustainable Development Goals is all about health and healthy populations and equity. And so the main thing is that no one should be left behind. And so having the kind of tools that we're developing within iSense allow countries to be able to reach to the lowest levels of the healthcare system, engage communities in the fight against infectious diseases.